For the assessments, we're going to review the patient's record in plan care regarding the patient's ability to participate in the procedure, include medical diagnosis, activity, order, or any order specific to hygiene and type of bath. We're going to assess also the patients to determine if there are concerns of a higher priority than hygiene. This might be related to other basic needs, such as toileting, fatigue, pain, and level of sedation, assess skincare and other hygienic practices, and any specific concern that might affect hygienic needs. We need to also to check to see whether special supplies or equipment are in a patient's room. For the analysis, we need to critically think through your data, carefully evaluate each aspect and its relationship to other data. We need also to identify specific problems and modifications of the procedure need for this individual. For the planning, we need to determine individual's patient outcomes in relationship to hygiene and plan the bathing procedure and determine the supplies that will needed for the bed bathing. So, good morning, ma'am.
Good morning.
Okay, so I already disinfect my hand, wash my hand before entering in this room, and then we need to identify two identifiers. So, good morning, ma'am. By the way, I'm Marlene Ho, your student nurse for today.
Okay.
So, kindly state your name for me.
I'm Jenny Melissa.
Thank you, thank you, Miss Jenny. And then we need to provide privacy to our patients, so we need to close the window and close the door. Okay, so I'm going to start. So by the way, ma'am, I'm going to explain to you the procedure. So we're going to do the bed bathing. Then there are some instances where you are going to expose some body parts. Is that okay with you, ma'am?
Yes.
Okay, thank you. So we need to adjust the bed in appropriate height, but because it's not in hospital setting, I'm just going to carry the pillow to become they're adjustable para upo yung patient natin. So ma'am, can you just here and then can you just are you comfortable with that position, ma'am?
Yes.
Okay, thank you. Then we are already raised the bed to an appropriate working position. So put the bed in a flat position. If the patient is medically unable to lie flat, then you will be able to alter the technically possible with the help of an assistant. But because our patient is active, then she can do in her own, and we are already just here to assess her. And then we are going to carry out the bed bath as follows. So first, I'm going to present the materials. I have here the towel. I'm just the towel here I already dropped in here, and then the towel that we're going to use in covering our patients. Okay, so we're going to put this. Before that, our patients already removed her clothes, and then we're going to change first to the other blanket first. So I can, excuse me, mom. Okay. It's here. So we are already done changing the blanket. Or then the next what we're going to do is put the towel. Ma'am, we're going to put the towel in your back. Okay. Then the other towel we're going to use in wiping the patient. Are you comfortable, ma'am?
Yes.
Okay. Going 56. So we need to also wear gloves for more for the prevention of contamination of infection. Especially that we are exposing some body parts of our patient para hindi siya mas lalong magkasakit. So we are done putting here, and we already prepared this. But before that, we're going to ask our patient, Ma'am, can you let out your other hand? And then, can you, is that appropriate level of warmness? Yes. Okay. Okay, so I'm going to start in your facial, ma'am. So we're going to put do the so I'm going to wash the face of our patient, and we're not going to use a soap for the face of our patients. And we're going to do the foldings here like this tightly. I need to use it. We're going to use it this way. Okay. And the first one that we're going to wipe is her eyes slowly. And then the other side. We're not side to side when we're using it. And then we're going to in the head. Going to here. Here. Going to the nose. And then we're going to wipe her in the ears. No? Yes. Then the other head. And then the legs, the neck of our patient. Can you do this? Okay, after cleaning the face of our patient, then we are going to wipe the arm of our patient. So can you let out your other arm? Going to we literally use bath soap when we're wiping the low extremities, but with your patient, mom, do you prepare with the soap? No, no. And then we're going to wipe also the other one. I'm going to cleanse first this. Mom, can you let your father? After washing the arm, let's go to